Welcome to Contemporary Retirement. Contemporary Retirement is a public interest program focused on the retirement community. Every program has segments on legal, financial, and health issues affecting the retirement community. Contemporary Retirement is sponsored in part by a major grant from the Family Heritage Trust Company.
Contemporary Retirement is sponsored by Family Heritage Trust Company. The Family Heritage Trust Company is an independent bank chartered trust company established by local professionals to provide fiduciary services including fee-based investment advice, trust services, retirement planning, and tax planning. The Family Heritage Trust Company is committed to client service in our communities. For more information, call the Family Heritage Trust Company at 301-631-5900.
Contemporary Retirement is sponsored in part by a grant from R. Thomas Murphy & Associates, P.C. R. Thomas Murphy & Associates is one of Franklin County's leading law firms, emphasizing estate, trust, elder law, and medical assistance planning.
Welcome to the Is It Legal feature on Contemporary Retirement. Is It Legal focuses on the legal issues affecting the retirement community. With me today is Tom Murphy from the R. Thomas Murphy Law Firm with offices in Waynesboro, Chambersburg, and McConnellsburg. Welcome to the show, Tom.
Good morning.
Tom, we've been talking about Medicaid traps, and probably the single biggest trap of all is everybody thinks all the information necessary to do everything in life is on the internet.
Yeah, and you'll frequently have people bring you printouts and everything else, but the reality is it's not specific enough, it's not current in most cases, and the techniques that we use, you just don't find them out there.
And part of the problem is it's a federal program, state administered. So all 50 states are free to work within certain guidelines. So anybody that publishes something that says it is fact specific to every state is just guaranteed to be wrong.
Right, and we deal with so many different counties where, that county's interpretation of their own state's rules are different from what you would find. So, you just got to deal with it as an art rather than a science.
And so the reality of it is that people think they can do this themselves, and the fact of the matter is that they might be able to, but the chances that they got an optimum result is virtually zero.
Yeah, when you're facing a $10,000 to $20,000 a month nursing home bill, you're really gambling that you're going to blow a lot of money unnecessarily.
So the next trap that we deal with all the time is, well, the nursing home's going to do it for free.
Absolutely. Well, IRS doesn't do my tax return. I wouldn't let the nursing home tell you how to protect yourself financially.
Well, and there's a problem here is that they are economically incented for you not to get the optimum answer. They have a higher private pay rate than a Medicaid reimbursement rate, and the fact of the matter is that they are not qualified to do the more sophisticated planning that we do that allows us to protect substantially more resources.
Right. They're looking at slapping together an application, and if you get approved, great. If you don't, well, they're going to get paid more.
Well, and we see applications being made all the time where people are just clearly not eligible.
Right.
And oftentimes when a person makes an application, they get a denial. Well, they're assuming that there was nothing they could do, and they just roll over and accept that consequence when in fact the application wasn't done right. And the fact of the matter is that in many instances you could have improved that outcome substantially.
Exactly. And so the key is being eligible when you apply so you don't get that denial. And the nursing homes in many cases, it almost seems like it's a game where they're counting on you getting denied because they can continue to bill you the full private rate.
And then we have people get denials, and family members are then contributing money toward paying for periods of ineligibility. And and the people don't realize this is a serious business. You're talking $10,000 plus a month for that nursing home bill. Anybody who thinks not getting a consultation from a high-quality elder law attorney to assure themselves that they are doing the best that they can is just a foolhardy savings.
Yeah, and so we frequently sit with people, and if there is something we can do, we'll lay it out. If there isn't, we'll tell them straight out, because not every situation merits going through the Medicaid process.
And I often tell people, just because we can does not mean we're going to. There are sometimes economics that don't dictate doing it. The easiest is where a person has already got a very short life expectancy. Oftentimes people are worried that that they're going to spend more, but their life expectancy says they're not. As we oftentimes tell people that I have virtually no one that I've done a Medicaid case that's in a nursing home because of cancer. You know, they just tend not to go to the hospital, go home, go to the hospital, go home, almost never go to a nursing home for an extended stay. Whereas on the other hand, obviously dementia, you know, or significant bone disease or so forth may result in substantial stays.
Right, and that's an example of getting a very specific answer after doing the analysis of all the facts to determine what's the best outcome for the client.
And so, and then of course we have this separate sets of rules here. Sets of rules for married couples, sets of rules for single people. They have absolutely nothing to do with each other.
Right.
And yet everyone out there at the public thinks it's a monolith, a single set of rules that applies in both circumstances.
That's exactly right. And you hear that all the time. And it's just, that's how nuanced the rules are. And people are often surprised that, you know, the married couple rules protect and allow you to do things that you couldn't possibly do as a single person.
Yeah, and then of course our challenge is as non-qualified lawyers who went to a you know to a single continuing ed class. It sort of suggested to them that there was nothing they could do, which is just simply not true.
Yeah, that's a big challenge for us because we'll often have otherwise very qualified professionals giving advice on something where they're not qualified on. And it's like you and me talking about plumbing, electricians, or anything else. We're not qualified.
Tom, as always, thanks for taking time to appear on the program.
You're welcome.
More from Contemporary Retirement after these messages.
Few things in life are as important as family. Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
Every life that meets its end leaves a heart for love to mend. Sister, brother, family, friends are left to carry on. When the loss seems more than you can bear, it's nice to know that we'll be there at Double Safe Fiery Funeral Home. We care.
Call Ed Lowe to help put your mind at ease.
Welcome to a special guest feature on Contemporary Retirement. This segment focuses on various issues which are of importance to the retirement community. With me today is Doug Wright, Chairman, Senior Living Alternatives, otherwise known as Holly Place. Welcome to the show, Doug.
Thanks, Mike. Great to be here.
You know, Doug, Holly Place is one of my favorite facilities, and it's really addressing a crucial need. We have senior living apartments in which they're subsidizing through HUD and so forth. We have nursing homes, but what we don't have is facilities for low-income people that don't need to be in a nursing home, but need services beyond being in a senior apartment complex.
That's true. There's nothing like it. We're very unique in fitting that. We only have 15 beds, and the need is much, much greater in this community as well as the entire state. Folks can no longer live independently, but are not in such a state that they can go on to a nursing home.
So we have the Monteview home in Frederick, which we've had on the program. We have Holly Place, but once you get past that in Western Maryland and nowhere in southern Pennsylvania that I'm aware of, or in West Virginia, is there a not-for-profit low-income assisted living facility to deal with the fact that people need significantly more services in a senior apartment complex, but do not need to be in a nursing home.
All right. I mean, our residents, we feed them so they don't have to cook. We do their clothing, cleaning, all their laundry needs. We help assist them in bathing so they hopefully won't fall in the bathtub by themselves. Help them just get around, get them to doctors. We take care of all those things, which they couldn't have done still by themselves.
And so, you know, when you look at an assisted living facility at $5,000 a month, that's fine for people who have resources. They're not there except for that they need to be there. Right. And so we have people who are Social Security only, many times is their income, or it's significantly less than $5,000 even if they do have a small pension. And when your facility accepts that person, what is their required payment?
Whatever they can afford to pay. There is a form that they can keep a small, like $20 or $30 a week, for own personal purchases, but most of our people can afford to give us between $700 and $1,500 a month, and it costs us $3,300 a month to take care of them.
So it's a not-for-profit assisted living that was established a number of years ago by a bunch of well-intended people, many people who are actually involved in the nursing home business, recognizing that on a personal level they need to provide an alternative for low-income people.
That's right, and also it was founded by, under the assumption and the guarantees really of the state of Maryland that they would be able to help us with this shortfall, and that has since gone away.
Yeah, the government got all paranoid that people were going to go to for-profit assisted living facilities and they were going to pay for it. It was actually foolhardy because the reimbursement that you were giving, no for-profit person wanted anyway.
No, they don't. No. We're happy to take it, but there's so few of those authorized in the state of Maryland that we just don't have that many in our facility.
And West Virginia and Pennsylvania, to my knowledge, doesn't have any subsidies at all for assisted living. So, you know, a bunch of us, yourself, myself, have been focused to keep this facility alive and try to figure out how to expand it. As we talk about, we have Director Gregg pull up some pictures here. So it is in a downtown facility.
268 South Potomac Street.
And that looks like multi-story, which looks like a little bit of a...
Yeah, it's 3 stories. Most of the residents are on the 2nd floor, and so there is an elevator that we're worried about, but it's still working. We're keeping it together, and we have staff that has to run up and down all the time to make sure everybody's taken care of.
So, and you support these people completely, 7x24, medication management, but it is a nice home style environment as we see.
Very much, yeah, very much. Our residents love it. It's their home. They call it their home. The families that can come to visit them are impressed. It is really a loving place. Our staff is great, and you can see it's a very nice facility. We have common meals. We do have a kitchen. Everything is prepared fresh and warm. So,
and we need help.
Always, yeah, because our residents can only afford to pay a small portion, even less than half of what it costs to take care of them. Then we need help, and we always the community has just done a fabulous job, and is still doing a fabulous job of supporting us. Almost 45% of our income and our needs is being supported by the community. $260,000 a year this past year has come from our community. It's still a struggle, but wow, we really are so appreciative of that support.
And support can manifest itself a lot of ways. It could be, you know, contributing items that are of need there.
Yep.
It can be foodstuffs, and it can also obviously be cash.
Yeah, cash is the most important thing because we got to pay our employees, and they're the ones that are taking care of our residents. So cash is big.
All right, so how could they get a hold of you?
They can call Holly Place at 301-733-3008. Or if they want to just reach us by mail, it's 268 South Potomac Street in Hagerstown.
And any amount is appreciated.
Oh my, any amount, absolutely. We didn't get to that $260,000 by 2 or 3 givers. Many givers.
As always, Doug, thanks for taking time to appear on the program.
Thank you, Mike. Great to be here.
More from Contemporary Retirement after these messages.
Tranquility at Fredericktown Assisted Living and Memory Care provides a warm, home-like atmosphere that promotes daily life enrichment. At Tranquility, our medical director is a geriatric physician. Our professionals support and understand the various stages associated with Alzheimer's and dementia. We have on-site physical, occupational, and speech therapists, as well as around-the-clock licensed nurses. For more information, give Tranquility at Fredericktown a call today, because everyone deserves great care. Let us do the caregiving so you and your loved one can embrace life again.
Dad, there's the big one. There's the big one.
Just wait.
There's the monster.
Just one more bid on hurleyauctions.com.
I got it.
If you haven't visited hurleyauctions.com, you don't know what you're missing. Whether you're buying or selling, antique cars, tractors, boats, or real estate, you can do it all at hurleyauctions.com.
Get to know Dr. Carrie Hesley at Diagnostic Imaging Services.
What I find most rewarding is caring for women through our Women's Imaging Center. We have a caring staff that will ease patients through an ultrasound, bone densitometry, breast biopsy, or mammogram. Our health team is sensitive to emotions involved in women's imaging and understands that every woman is at risk for breast cancer. Providing the community with a center that is so dedicated to breast health and the imaging needs of women is something special.
DIS Women's Imaging Center, providing women with progressive care.
Welcome to Contemporary Health Scene. Contemporary Health Scene focuses on the health issues affecting the retirement community. With me today is Paul Sweeney, President of Quality First Insurance. Welcome to the show, Paul.
Good morning, Mike.
Now, why are we talking to an insurance executive?
Well, because we specialize in insurance products for people that are retired.
So people don't realize that Medicare has not been around forever. Originally 1965, and it had all kinds of holes in coverage. It was really designed as just a catastrophic safety net, but in fact, people wanted better coverage than that. So what evolved?
Well, it's interesting. It's an interesting evolution. In 1965, when Medicare was created, there were two different parts. There was Part A, which covered you when you went into the hospital and admitted, and there was Part B, which covered medical expenses.
And they had deductibles and substantial risk of substantial outflow, but it was really designed to not have your health costs be catastrophic.
Yeah, because many times there was nothing really for people before that were retired unless you had an employer plan that decided to continue to cover you. So it was created by the federal government to cover people once they retired and reached age 65.
And so then an insurance product developed, not a government program, but an insurance product developed. What was that called?
It was called a Medicare supplement, and it was designed to work with Medicare and pay the different deductibles and the different copayment amounts. But unfortunately, there were regulations in place to kind of monitor how those products were put together, but there was nothing uniform. There were thousands of different types of Medicare supplement products out there.
And one word in one product did not mean the same in another product, because each product was defining what their coverages were. And so it really is the old saying, took a Philadelphia lawyer to figure out the difference between one policy and another.
Yeah, that's one way of putting it. Yeah, it took legal advice sometimes to figure out exactly what a plan was actually going to pay and what it wasn't going to pay.
So then what happened?
Well, in 1992, actually probably about a year before that, the National Association of Insurance Commissioners, for our listeners that don't really understand, each state has its own different insurance commissioners, over 50 different commissioners that regulate insurance products. But they all got together and decided we're going to make this a lot easier for people to understand and compare, to make products simpler to understand.
So they designed 10 products, and every company that was going to be in the business had to subscribe to selling one in particular, but then otherwise they could select which ones, but the coverage was identical from company to company.
Right. In 1992, they created plans A through J. A couple of plans actually included prescription drug benefits, because back in '92 there was no prescription drug benefit under Medicare. So it was important to look at that type of thing. But you're exactly right. If somebody was looking at a Plan F, for example, with Blue Cross and Blue Shield and wanted to compare it to a Plan F with United Healthcare, the benefits would be identical.
Contracts were identical, and all of a sudden we went from just an absolute free-for-all to an opportunity for people to actually be able to say one company, one policy is the same as the next company. In fact, spreadsheets were developed to show what those coverages were, and it became very easy for a client to begin to figure out which coverage made sense for them.
Yeah, there were other little nuances involved with it as well. Like if somebody, before 1992, if somebody had a supplemental plan and wanted to replace it with another plan, many times the new carrier would create or enforce a pre-existing condition period. So many times people would have policies that overlapped, and it really wasn't in the client's best interest. So now, starting in 1992, anytime somebody replaced one supplemental plan with another supplemental plan, there would be no pre-existing condition limitations at all applied.
And so as the product evolved, then people wanted to be sure that they could get it, and so then there evolved sort of an initial open enrollment period that people could actually select a plan of their choice. If an insurance company chose to be in that business, they could not medically underwrite during that open enrollment period.
Most people think that it's when you turn 65 and become eligible for Medicare, but actually it's when you enroll in Medicare Part B. When somebody enrolls in Medicare Part B, that creates a 6-month window or 6-month open enrollment period for that person to sign up for any supplemental plan that they want.
And so people don't realize that sometimes when they enroll in Part B while they're still covered by an employer plan as primary, they've actually started that open enrollment period and may have lost it.
Right, that could be a big mistake. And it's an interesting dynamic now because full retirement age has been moved back. It used to be 65. Now it's 66 and I think a couple of months. And many people decide that they want to continue to work. They don't want to draw Social Security yet, so they'll stay on their employer-sponsored plan. And it's perfectly okay if you have an employer plan to defer signing up for Medicare Part B.
And yet that urban myth out there is that you must sign up for Part B when you're 65 or there's a penalty, and the answer, like everything else, it depends.
Exactly. There only will be a penalty if you're not covered by an employer-sponsored plan.
Paul, as always, thanks for taking time to appear on the program.
Thanks for having me, Mike.
More from Contemporary Retirement after these messages.
The Community Foundation continues to create great impact in Frederick County, thanks to generous donors. As our community evolves, so do we. While we don't have a real crystal ball that can predict the future, we are poised and ready to see things differently and help nonprofits, city and county agencies, civic groups, faith-based organizations, businesses, families, and individuals to solve problems within our community.
Albright, Crumbacker, Mal and Idtel are a full-service firm that provides elder care services including managing incoming bills, bill payment, depositing checks, balancing bank statements, and preparing, planning, and filing personal tax returns. Put your mind at ease and call us today.
Welcome to the Making Sense feature on Contemporary Retirement. Making Sense focuses on various financial issues affecting the retirement community. With me today is David Twenhafel, Senior Vice President at the Family Heritage Trust Company. Welcome to the show, Dave.
Thanks for having me, Mike.
Yeah, Dave, at the Trust Company, we oftentimes talk about a three-legged stool in the way we approach representing clients for finance. One, they want to be secure, they want to avoid unnecessary risk, and they want to be comfortable. And one of the interesting things is being secure is easy. Everybody wants to protect themselves and be secure.
Right. They do, but a lot of times they mistake security right now for security in the future.
And so that could be, we talk about something called the rule of 72. So if you have CDs yielding 1%, means it doubles in 72 years. But if inflation were to hold at 3, that would mean the cost of living would double in 24 years. Right. You will have cut your purchasing power in half in 24 years. Oftentimes we're looking at a 75-year-old client and say, well, I don't care about 24 years. But how many of those clients that you deal with are routinely spending more than they make?
Almost none of them. I mean, the vast majority of them will spend their income. They have a real hard line about, I don't want to spend my principal, I'll spend my income. I want to leave the other money to my kids or grandkids.
And more often than not, they're not even willing to spend the earnings off of the investment account. They're looking strictly at their Social Security and pensions. They're not willing to spend any more than that, which really means it doesn't matter that your life expectancy is less than 24 years. The people who you're planning to give the money to do have life expectancies well in excess of 24 years.
Yeah, I mean, if someone has a 30-year-old child who expects to inherit money, the investment horizon is more like 40 or 50 years.
And so oftentimes, there's security, but security does not manifest itself in a slow death. It actually manifests itself with the need to realize that you need to take a long horizon to this stuff. And if you look at the market over a long period of time, most people only focus on the down years, but in reality, 3 out of every 4 years, it's up.
It's up. It's on average 2 out of every 3 days it's up.
And so, and that's just simply the fact that business is expanding, population's expanding. This doesn't then mean that there isn't uncertainty, but the fact of the matter is, a slow death is a guaranteed loss.
Well, a slow death is a death. So yeah, right. That's true.
And so then the second element is we want to avoid unnecessary risk. And that means you have to look at each client's risk tolerance.
Right.
If a person's spending more than they make, which we have occasionally in an assisted living environment or so forth, well, the fact is they can't deal with account volatility, and so you may take a more conservative approach. But if you're sitting there looking at a 70-year-old with no future health issues on the immediate horizon, and they're already making enough money to support themselves, they can accept significantly more risk in the short term in order to gain long-term gains.
They can and they should. And a lot of times when we're doing financial plans for people, we'll use a life expectancy of about 95. And what I find is people have one or two reactions. They say, I'll never live that long. Or they'll say, 95, I'm going to live much longer than that. But it's really the first group. And I always tell them, I'm really concerned about getting beaten up by someone who's 96 who told me they were going to die when they were 86.
And then we talk about comfort. It's a three-legged stool. So first of all, it's security, avoiding risk, and then people have to be comfortable. And that means that one size does not fit all. Everybody's personal circumstance has to be taken into account.
You have to look at what do you spend, what do you want to spend, how do you like to live, and personalize your investment portfolio to your needs and your situation.
And so you'll sit and you'll talk to people about what do their investments mean. You know, we'll talk to people about, you know, CDs means you're going to lose. It means that most bond portfolios have significantly more risk attached to them than people realize. They think they're guaranteed. But, you know, the federal government bonds, you know, have not yielded anywhere close to inflation for a long period of time now. And so you're essentially guaranteeing, as we call it, the slow death.
Yes. And the federal bonds, I mean, people were, one of the reasons they've returned so little is that people were very anxious about other bond issuers. So everyone was piling into the federal bonds, driving down the interest rates.
And so as you look at this stuff, you sit down, you talk to the client. There's no one size fits all. The trust company does not have any economic incentive toward one investment versus another.
No, we charge a fee for the value of the assets that we manage and advise people on, and it doesn't matter to us what it is. What matters is that it's the right investments for them.
And then that word that everybody kind of struggles with, fiduciary, what does that mean?
Fiduciary means we put your interests first.
People say they are, but in reality, the trust company has a legal obligation to do so.
Yes, we are legally obligated to do. Most brokers, there's no legal obligation to be a fiduciary.
So how could someone get a hold of you?
They can call us at 301-631-5900.
Dave, as always, thanks for taking time to appear on the program.
Thanks, happy to be here.
Thank you from Contemporary Retirement.
Remember a more carefree time? Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
These days, it seems like everything's online, and filling out claim forms and receiving and paying bills online isn't always easiest. That's why we at Quality First Insurance encourage you to just give us a call. Let us help.
Hi there, I'm Paul Sweeney with Quality First Insurance, and it's still just this simple. Our offices are open every weekday where you'll be able to call and speak to real, live people.
No detail was missed. I'm so glad that I turned to Quality First Insurance.
I've recommended Quality First Insurance to my friends who've been just as satisfied.
If you're not happy with what you're paying for Medigap, or more importantly, not happy with your service, give us a try. We're locally owned, and we take the time to provide you with the best. We are Quality First Insurance, and our mission is to provide quality products to quality people. Pick up the phone and give us a call today at 800-745-1411.